This week's Ask Dr. Dury is the big ongoing question for the majority of myeloma patients, which is, with the COVID-19 pandemic, what does the future hold? Well, I think unfortunately through these upcoming winter months, the COVID-19 pandemic is going to continue to be with us. And also, unfortunately for myeloma patients, it will be a little bit of time until we know if any one of the vaccines in development will work well for myeloma patients who are mostly a little bit more elderly and obviously do have a compromised immune system. The good news, however, is that if a COVID-19 infection does occur, we are learning a lot more about how to better manage the disease. And for example, the myeloma treatment, dexamethasone, does in fact work to improve the lung problems in patients with COVID-19 infection. And so if, God forbid, someone is hospitalized with COVID-19, we are better able to get them better and to avoid the use of a ventilator and to get these people out of the hospital. So this is really, really the good news. However, there is no doubt that in the short term, the use of masks, physical distancing, and avoiding crowds and indoor spaces is really very, very important. And that will continue to be the case through the winter months into the new year, I'm pretty sure. And so bottom line, it is still essential to try to stay safe. And with these measures, with the masks and distancing and the like, it definitely is possible to stay safe. That is the really good news. The only additional thing that I strongly emphasize is that since you're mostly staying home and not getting together with many family and friends, social networking in some fashion is really, really important to try to stay sane and to maintain some connections and really get by in the best possible way day to day. So please, physically distance, but socially network.